because, breast cancer's kind of gotten this fan base around it, and they have walks and, wristbands.
Concerts.
Yeah, concerts, the whole shebang. Ovarian cancer doesn't really get that attention. So what would your opinion be or advice out there for awareness, when it comes to ovarian cancer awareness?
Yeah, I think it's a great point. I mean, if you look at the numbers, right, ovarian cancer is about 10 times less common than breast cancer, okay? So some people will argue, well, it doesn't have that sort of big national awareness because the numbers aren't there, right? But if you look at mortality, right, if you look at the number of patients that die from the disease, right, it's 3 to 4 times more lethal than breast cancer, right? We've gotten much better at detecting breast cancer early and being able to do something about it. And yet, despite that, ovarian cancer still remains one of the most lethal cancers, really right up there with pancreatic cancer and brain tumors. And so, awareness has to be that this is not just a disease that's less common. It's a very lethal disease. And so we need to be not only aware of what's available for screening, which you just talked about, but also in terms of clinical trials and being, active in terms of your own health, right? Your best advocate is going to be you have to know your body well. You have to know what is normal for you and what isn't normal for you.
Right.
And we know too often that patients will get non-specific symptoms. Right? Ovarian cancer was always thought to be the silent killer. It's not silent. It has a lot of symptomatology that, if you look at studies that have looked at patients who ultimately developed cancer and then they go back sort of in time to see when they started with symptoms, somewhere between 6 to 12 months before they ever got diagnosed, they were having symptoms. Now, those symptoms are not specific. You go to your primary care doctor and they're going to tell you, okay, something about your diet or reflux or things that are more common, right? But you know yourself, right? If those symptoms are not typical and they persist for weeks, you really have to sort of advocate and keep going back to your doctor, because that may be a harbinger of something more serious. So I think you have to be sort of aware of your body, aware of what's out there in the literature and in the space, and then really advocate, get involved in all the groups, Overcome, OCRFA, Tina's Wish. I mean, there are a lot of groups out there that are trying to get the word out.